My next guest is joining us from the front lines of the battle against coronavirus. We've got an ICU nurse joining us, and we will not be using your name tonight. Hello, sir.
How are you doing today, Jason?
Very well, and thank you for returning. People who don't recall, our first phone call took place just a little over a week ago, and you told us in general that you weren't seeing the type of crowding in your unit that we've heard about on the news. What can you tell us? What's happened in the past week?
Well, it has really changed, Jason. We went from just having a few patients with coronavirus that were ventilated patients to greater than 30 patients that are positive for the coronavirus.
30. And what's the maximum capacity of the ICU there?
Well, there's bigger institutions have different types of ICUs. So most ICUs have anywhere between 20 and 30 beds for patients that what we call like a medical ICU. That's just a general care ICU.
Mm-hmm. And we've got someone saying normalization. It would be a HIPAA violation for that nurse to identify himself or the hospital. So we're not going to identify you, but it's an interesting topic that takes us a little bit off what you and I are going to focus on. People who've been watching Crowdsource the Truth are aware that I've been really questioning some of this New York Times reporting with regard to Elmhurst Hospital Center. I'm sure you've been following that, right?
I've been following some of it. I've been following some of the stuff you said more about Mount Sinai Hospital.
Right. And what were your thoughts about that?
Well, it's really hard to judge on the amount of patients that they have unless they divulge that information. So you can have patients in an ICU, and you really can't tell that from the traffic outside the facility, because in this situation right now, they're restricting visiting. Most facilities are not permitting visiting from the patient's families to control the spread of it. And they can get people coming in from other facilities in an ambulance. And if their capacity is only, let's say, 20 to 30 beds, if they already have 20 patients and they get 10 more over a 24-hour time frame of getting those patients is like a trickle. It's really not that many that you would see.
Wouldn't see. So when you see me walking around New York City, and I'm finding it remarkable that there's virtually no ambulance activity, no sirens, EMTs that have time to stop and speak to me, that doesn't seem unusual to you?
No, it does not. And the reason I say that is because you have to think of the capacity of a hospital. So if a hospital ICU for, let's say, that type of unit is only 20 or 30 beds, the hospital bed capacity for the whole facility could be anywhere from 400 to 600 patients. So there's the difference in number of patients of that type of care versus what can actually go as far as the general population is so much smaller. It's not going to be reflective of the critically ill patient that is going to have ICU needs.
Mm-hmm. And so in this New York Times article, the original article that came out, it describes this apocalyptic situation where there's 13 deaths in a day. Now, obviously that's a large number. How many people typically die at a large hospital in a given day? Outside of a pandemic, what would be a normal number of deaths in a day? Obviously, zero. There could be days with zero, but I got to imagine when you're dealing with ICUs and heart attacks and car accidents and all the things that come into a hospital, I think a lot of people die there, right?
Correct. In a day time frame, that's kind of hard to judge. You could only get anywhere from, since I only work in one unit and I don't know the numbers for a whole facility, you can get anywhere from, I would think, from 10 to 20 patients in a day. There could be a lot less, there could be a lot more, depending on the day and what's going on. in that facility at the time.
So for a large hospital to, because also, even though we're in New York City, one of the largest cities in the country, Elmhurst, Queens is not really as densely populated as Midtown Manhattan, and the Elmhurst Hospital Center is pretty large, but it's not necessarily as big as some of the biggest hospitals in the city. So what I've just heard you say is that a death toll in a normal day between 0 and 20 patients doesn't sound outrageous to you.
No, but this is a lot different because let's say if we dialed back a year and I said how many patients that I would see die from, let's say, influenza A flu virus in a month's time, there could be a month where I wouldn't see any. There'd be people dying of other things, or they could come to the ICU and have influenza A and survive. But for a whole month's time, I might not see one. And right now, it's not uncommon to see 10 patients die, I would think, in this situation with the coronavirus in a day.
Right. We're getting so many
and the
conflicting...
coronavirus is...
Sorry.
The coronavirus is a little bit different because people's reaction to it is a lot worse than the influenza A that we've seen last year and the years before, and the H1N1 virus. Our reaction to this virus is a lot different. People are getting sicker, they're having kidney failure, and the kidney failure is not from, it doesn't seem to be from hypotensive episode where you have a low blood pressure. It just seems to be a reaction to the virus.
We haven't heard about kidney failure from the president's task force or anybody in the mainstream news. That seems like an unusual symptom. Are we sure that's coronavirus?
Yes. And I think there was published data from China that they had significant kidney failure from that also.
So just to get back to
and
this...
it's not uncommon to...
Not uncommon to what?
Go ahead. It's not uncommon to have kidney failure with infectious picture when it's severe, but it seems like this reaction that we're having with the coronavirus is it's a different picture than the typical picture with sepsis, because sometimes the blood pressure is not affected and the kidneys are still failing. We're usually in patients that are septic, that have what is a septic picture, is where you have an infection that travels to the bloodstream, where in a non-septic patient, the infection doesn't travel to the bloodstream and you maintain a good blood pressure the whole time.
So how is coronavirus causing these patients to be septic? I don't know very much about the details of medical stuff. Obviously, I'm not a doctor, but I understood that sepsis comes from a bacterial infection.
It can come from any type of infection. It can, it just depends on if it can make its way to the bloodstream. So, so the sepsis that they're getting affects more of the lungs without getting into the bloodstream, but it's causing a major reaction to a major lung failure with this virus. It's a lot more significant than what we see with influenza A or H1N1. There's no comparison between the two.
I want to go back to this very first question that we got from Iris354, who's watching on YouTube. It says, normalization. That might be a mistake. It might be normally. It would be a HIPAA violation for that nurse to identify himself or the hospital. Now, you haven't done either of those things, but it does bring us back to the point of this Dr. Colleen Smith, who very clearly has identified herself, the hospital. She's shown video footage inside the ICU or the ER, whatever this is, showing patients' feet. They're obviously not identifiable. I spoke earlier today with a lawyer here in New York City who specializes in HIPAA law, and obviously, asking a lawyer over the phone about a complicated case is like calling up the hospital to get diagnosed without coming in there. But in general, he said that it may not be a HIPAA violation. However, any MD or medical professional that I've spoken to found it absolutely outrageous that a doctor would, video record inside the hospital, let alone the ER or the ICU. What do you think about that?
From what I understand, HIPAA violation is where you mention a person's name is identified, is talked about in public, or the person's name comes up with some type of identifiable, like a medical record that gets looked up by a health professional. But talking about medical conditions without people's names and their conditions, that is generally not considered, from what my knowledge, is a HIPAA violation.
Okay. So
you have to mention somebody's name. I mean, I would think that a hospital could do I wouldn't say promotional, but some type of talking about their facility, and could take a video of the facility, and as long as no patients' faces were mentioned or their patient information were mentioned, then that would not be HIPAA violation. And you can actually get permission. Let's say if you want to do a promotional position for your hospital, where you could ask permission from someone, because let's say you did this surgical procedure on them and they had a great benefit from it, and they wanted to share that success with other people so they could see the benefit from maybe this type of surgical procedure or medical treatment. So there's facilities, and they have patients' pictures on the wall, wallpapered, and because they want to.
Well, these are patients who've consented,
talk about
obviously.
Their success.
Yeah,
exactly.
But people who are, lying unconscious and close to death in the ER are probably not going to consent. So tell us a bit more about the evolution from last week, because, I mean, you and I never spoke before you called me last week. You told me you're a viewer of the show, and what you were seeing at your hospital did not match what you were hearing in the mainstream news. When did the change begin, and what do you attribute it to?
I think the change began like halfway, midweek. We just, the numbers just kept doubling of patients that needed ICU care. And they're not doubling anymore, but we have a lot more capacity to take these patients. I just attribute it to that there just must be more people out there that are in situations that have been exposed and to the virus, and those people are at risk for having a poor response to this infection. And we talked before, anybody that has a poor response to a flu virus in the past, or they have other disease processes that have an ability to fight a virus, whether it be diabetic, if they have heart disease, if they have lung disease, from no matter what, if they're immunosuppressed, someone that is a transplant patient, all these people, all these factors are factors which, make it more difficult for your body to fight an infection. And these people are getting hit really hard that are getting this infection with these comorbidities. It's still very, very, very few people end up in the ICU with this infection. It's all people that pretty much have comorbidities.
And that's consistent with what you told me last week, that these were people who had immunocompromised people who had organ transplants or cancer treatments ongoing, and that type of thing. We've been hearing so much contradictory reporting, not just in the birdcage liner, the New York Times, but we've been hearing from overseas that there's young people getting it. And obviously you can have, we've seen videos and GoFundMe things for little babies who have cancer. So anybody could be immunocompromised. You're telling us it's still the case that it's primarily, or in your experience, only people who are immunocompromised.
I wouldn't say only. There's always going to be a few that aren't, but for the most part, 90% I'm not sure if that's an accurate number, but there's very few people that, if they're healthy, they don't end up in an ICU if they have if they get this coronavirus.
So someone says doubling ICU care. Oh my God, he is not being honest. Nobody in NYC reports that. Jess VM, I'm not sure what you mean by that. So what I'm getting over here in the comments is a lot of people feel like, how can we reassure skeptical viewers, given that you and I don't know each other? You contacted me 10 days ago for the first time. What would stop someone who wants viewers of Crowdsource the Truth to believe that this is a growing problem from inserting somebody like you? And I'm not accusing you of doing this, but it's a valid line of questioning. Let's say someone observes Jason Goodman going around New York City, video recording these hospitals where there's no activity, there's EMTs basically laughing when I ask them, are they dealing with a lot of coronavirus patients, and why are they stopping to talk to me if they are? That happened today. What would stop someone from having you call me last week, agreeing with what we're saying, to only then this week flip-flop it and say, oh no, it's serious? How can we reassure these people that that is not the case, if it isn't?
Well, the only way you can probably be reassured is if the facility would say, instead of saying we have 200 patients in our facility that have coronavirus, they'd be more specific. Let's say they would say we have 20 or 40 patients on the ventilator with coronavirus. I'm not sure. I don't think that's a HIPAA violation to say that, but it's probably not something that they want to share. Mm-hmm. But let's just take. I don't know anything about Mount Sinai Hospital in New York, but let's just use this for an example. So let's pretend, I don't know the facility, let's pretend that they have between 20 and 30 ICU beds for the medical ICU. So they get their patients in and they become sick enough that they need a ventilator, and then 1 week they have 5, 2 days later they have 10, and the next day they get 10 more. Well, if they're at 25, for instance, and they only have 30 beds, there are other ICU beds in the facility that can take a ventilated patient. There's a surgical ICUs.
Let me stop you a second, because this sort of generalized answer I don't think is satisfying the question. People want to know how can we be reassured that you were not sent here a week ago to gain our confidence with a story that, hey, there's nothing going on, to only now turn around this week and say, oh yeah, it's a huge problem. How can we be reassured that that's not happening?
Well, I guess if they can't trust, what I'm saying, that the only way that they can get that trust is if a facility would come out and publicly say, we have this many ventilated patients.
Well, but of course, we don't know what facility you're working at, and I'm not trying to ask you to reveal that, but this is a valid question for the viewer to have. I mean, we've seen these videos on Twitter and elsewhere of people who are allegedly hospital workers kind of like loading bodies into a truck as if they were, bales of hay or something like that. And it doesn't really make sense to me that somebody would do that. It seems kind of like the opposite of something that a person working at a hospital would do. So there is a fair amount of skepticism that viewers of Crowdsource the Truth are having. And what I've noticed is if somebody posts something on Twitter or 4chan or whatever it might be, as long as it conforms with some expectation of what the person seeing it would have. Like, I'm showing a video right now that was sent to me by somebody on Twitter who I don't know. And it's 2 guys, unidentifiable, wearing what looks like hospital gear that you could purchase basically from anywhere. And they're dragging, what looks like a body bag. But I mean, look, I'm not trying to dig into grisly details of who's inside the bag, but we see one item being dragged into this truck. And although if you are ready to be convinced that this is a truck filled with dead people, this might be evidence, but in fact, this could easily be false evidence. So it's a difficult thing that I'm trying to do, because of course I want to trust you. I don't inherently distrust you, but it is a valid question for people to ask. There's so much disinformation, misinformation, social engineering going on. I mean, I've been very skeptical of this Dr. Colleen Smith, primarily because she's an expert in medical simulation, and some of the things that she's said and done in this New York Times video, they don't really seem to match. And as far as your suggestion of how I could corroborate this, I don't know what hospital you work at, and certainly if I called them and said, you called me up and said all this, we've got a little bit of a problem because it's sort of impossible for us to verify. Is there a way that we could get around that?
I guess the only way you could get around that is if you could talk to an administrator like at Mount Sinai and just ask them if they wanted to, if they
But
could
you
be
don't
more
work at Mount
specific.
Sinai. That wouldn't give us confidence in what you're telling us. So I did call the hospital, and not your hospital. I called the Elmhurst Hospital Center, and I spoke to their media department, and there were a number of strange things about it. They did not want to tell me anything. They asked me to email my questions to them, and that was about 10 o'clock this morning. No response from them. So I think people are feeling very frustrated. And when I go to the hospitals and we see hospital employees, they told us today in New York City, the alleged epicenter of this outbreak in the United States, I spoke to an employee at a coffee truck outside of NYU Langone on First Avenue. And that woman told me that the hospital was not remotely overrun. Has your hospital been in the news there in your part of the country?
No, not that I'm aware of. I don't watch the news very much, so I could not comment on that. If they have, I haven't noticed it because I really don't watch national news or local news. So.
Mm-hmm. All right. Well, so what else can you tell us about the patients? I mean, you don't sound super duper stressed out. Have you been working crazy long hours?
No, a typical shift for a nurse. The typical shift that we work. So no, not crazy long hours. So some facilities might have a more difficult time with this because if they're less experienced with patients that are sicker than what they normally can handle, then it's more difficult for them to manage. So facilities that bigger facilities that see sicker patients over time, the sickest patients that you can see, they tend to understand how to manage this type of patient better than a smaller facility.
Mm-hmm.
And some facilities are more prepared for a lot of ventilated patients. So, if a hospital only can, like I said, a smaller facility can only handle 20 or 30 ventilated patients because of their size, and that could, in an area where this process is going on, they would very, very easily be overwhelmed with the situation.
I mean, we're getting a lot of information about how a hospital might be overwhelmed. What I want to get to is something tangible that we can offer viewers who are hearing this and they don't know you. I don't know you. We have no way of knowing if you are being honest with us or if people's skepticism is rightly placed, in that there would be quite a lot of people who would be motivated to send someone to crowdsource the truth to tell us something that might cause people to question what we've seen when I'm walking around New York City. People have noticed there's no ambulance sirens. So, I mean, when I go to the front of the hospital, I don't see car after car driving up as if people are taking taxis or their family is taking them there. I don't see people walking in. I don't see ambulances. They're not out. They're all there, parked. We've seen an overwhelming number of ambulances parked on the street, parked in the parking facilities of these hospitals. We heard this morning that Mayor de Blasio has requested from FEMA 25 ambulances, despite the fact that I saw 10 parked on 23rd Street yesterday doing nothing, and there's been a large number of them around. So I ask again, how can we offer viewers who are skeptical of what you're telling us, who might suspect that you are trying to convince viewers of Crowdsource the Truth that coronavirus is a pandemic when people are doubting it? How can we convince them that you're being truthful?
Well, I don't know if there's any areas through social media where people are sharing loved ones that have passed from the coronavirus. I've taken care of patients, and they've had their other family members die of the coronavirus that they told me verbally, that were not on the ventilator yet. So I don't, like I said, I'm not sure if there's a way through social media if the hospital facilities don't want to share more detailed information about people that are on ventilators and that need ICU care. The people that don't need ICU care, that's just like a different story because their needs are less. All they typically need is additional oxygen and let's say if their kidneys weren't working very well, they could get intermittent dialysis, but they wouldn't need something like continuous dialysis if their kidneys quit working completely.
I think you're giving us a lot of details about, medical stuff, but it doesn't seem to be the answer that I'm looking for with regard to how we can verify what you're saying. I know you were busy all day and you probably didn't get a chance to see this video where I was walking around. I went back to NYU. There's a lot of ambulances parked on the street out in front of the hospital. There was no activity around them. There were no people coming in and out. If we had a pandemic and the epicenter was in New York City, why are these ambulances not being, sanitized from previous patients arriving in them? Why are they not driving around the city? I mean, listen, here's what I'll say. If I was walking around New York City and constantly hearing lots of sound of ambulances racing around, that would provide me with some tangible evidence that there was ambulance activity. But the only ambulance that I really saw doing anything today was this FDNY EMT ambulance. This is like New York City's main ambulance force. They were pulling out. I just raised my finger. Clearly I wasn't in a medical emergency. I spoke to these guys for 30 seconds, a minute. It would seem to me if they were racing to save someone's life, they would not stop to chat with me. And when I asked them why they did stop to chat with me if they're racing to save someone's life, the guy laughed, waved me off, and sort of acknowledged that there was no immediate emergency. So I have to ask again, how can we have some method that doesn't compromise your position with the hospital, but allows people to have some additional confidence in what you're telling us that it's true, rather than someone who is here to disinform us and cause us to believe something that isn't true?
Well, at this present time, I can't give details to verify that. I don't know of a way to convince the audience or yourself of a way of bringing out what I see. And I guess we can probably reframe this, what is considered a pandemic and what's not a pandemic. And I guess
I don't think people are interested in that. That's something people could look up on Google probably. But
it's the numbers. It's the numbers, because it's the numbers of people that would die. So if they said they had Mount Sinai had how many people die in 24 hours, 11 or?
Well, this is Elmhurst Hospital that said they had 13 people die, and they were, we've heard reports. Somebody sent me some report from Sweden or England or something that was saying that 5 people per hour were dying in New York. So I'm showing the portion of today's video where I just approached 2 hospital employees who were purchasing coffee from this sandwich cart here, and they told me that there was really nothing going on inside the hospital, and it appeared at one moment that the woman who is wearing the blue scrubs seemed to indicate to the woman who's just wearing the mask, that she should stop talking to me. I have to listen to it again to understand exactly what was being said. But there's been a real sense as I walk around and speak to EMTs and cops that they're holding back, that perhaps they know something that they can't tell us. And I don't know. I had hoped that we would have a conversation tonight that would help people gain some confidence in you and what you're telling us that I haven't seen elsewhere. But again, we haven't heard that there's a major surge in other hospitals. If anything, we're hearing that there have been less cases announced. I'm not sure that we're really getting anywhere helpful with this. What else would you like to tell us?
Well, it seems to me like, well, a lot of states are net testing people. The amount of tests that are being done is, like, if they say there's 30,000 in a state that are tested positive, I would think that number could easily be 100,000.
Based on what?
Because so many people, based on their symptoms. So there's people that say, I went to the physician because I thought I had the corona, and then the physician says, well, I'm not going to test you. And I've talked to people personally that have had that said to them, we're not testing you for corona, even though you have the symptoms. Just quarantine yourself.
Why do they
for
do
10
that?
to 14 days.
Why do the doctors do that?
I don't know.
So this is anecdotal information. I mean, you haven't been denying people coronavirus tests, right? Have you tested anyone for coronavirus? Have you been tested for coronavirus?
I have not.
You haven't tested anyone?
I have not been tested for coronavirus.
So how do we know that these patients have coronavirus?
Well, on their lab results, it comes back positive. So it comes back in their lab history when they test them. So even though I didn't test them, a nurse before me or another facility, let's say if they were transferred, were tested for the coronavirus, it would come back in those results. So, well, there's, I'm sorry that I don't have a way of verifying what I've seen without compromising my situation.
Of course.
I'm not sure if there's a way a facility could say, give more detail on.
Well, a random facility doesn't really have any bearing on what you and I are talking about. So I'm not sure what else we can really discuss. What do you think about Dr. Colleen Smith testing positive for coronavirus? What would be the policy at your hospital if a staff member tested positive for coronavirus? Would they continue seeing patients, or would they immediately be quarantined and kept out of the hospital?
Oh, they would be quarantined. They'd be kept out of the hospital. They could be self-quarantined for 14 days. This is what I think the typical response is from the management of the facility.
People in the comments are telling us that. Sorry.
Go ahead.
No, say again.
I'm not sure what Mount Sinai's hospital there, because she talked about that. But for instance, what people were saying, how can a hospital double their capacity to take care of the corona patients? So let's say Mount Sinai has 20 beds that they can take care of these patients. There are beds in other ICUs. There's beds in the ER where people come in and they have the equipment that can be attached to the walls for ventilators and the monitors for patients. So just because they do it, when you come to a situation where you run out of capacity to take care of it in one unit, hospitals become flexible and they can take care of them in other units because they do have the capacity for the oxygen and for the pressure for the ventilator and the monitors for it. So
I got to tell you that a lot of people in the comments are not feeling very satisfied with our conversation, so I'm not sure that it's taking anybody anyplace useful. I will tell you that I received a message from a friend of mine who lives here in New York City, actually quite close to NYU Hospital where that temporary morgue was built. And he's telling me that just a few minutes ago, he heard a lot of helicopters heavy-duty helicopters passing on the ground now. I asked him if he could take some photographs, and he said he can't see the ground from his window, but they come in and take off. And he said he heard 4 or 5 heavy-duty helicopters. He sent me a picture here of just a helicopter in the sky out the window. This is somebody I've known since college, so I do trust this person. And he's just texted me saying it's quiet now. There was about 4 or 5 in and out, it sounded like. You know, because the thing is, when I was over there by these refrigerator trucks today, we saw those gentlemen who were tenants at the Bellevue men's shelter who were telling me that they could smell the dead bodies. And I asked them where they could smell them from, and they said it was right where we were standing, but I didn't smell anything unusual. And after the show, I got some emails, including some from people who drive refrigerator trucks, who indicated that the trucks were not even on, that the refrigerator compressor would be making a lot of noise if it were running, and if the trucks were loaded up with dead bodies, we would hear those turned on. The other thing that's a little bit confusing about that is that the medical examiner's office is right there. So in order for those particular refrigerator trucks to be utilized, the city morgue would have to be totally full. And when I spoke to the medical examiner's public information officer, she made a point of telling me that it is not full, and that what was being done with these refrigerator trucks was just a standard procedural operation. So what can you say about the use of refrigerator trucks at your hospital? Is that happening? Has that ever happened?
Not to my knowledge, and I don't believe it's happening now either. So, but that is not something that I would even know where to look for if that were to happen.
Mm-hmm.
So.
And what about hospital employees video recording themselves disposing of the deceased? This seems like certainly a fireable offense, and I don't know, is this not a violation of something? Where are the families of these people who are being displayed on the internet? Like, I know if I think almost anyone, if you had a family member die at a hospital that was being nationally publicized, and then the bodies are being stacked in a truck, what normally happens when someone dies at the hospital? How is the body removed and given to the family or a funeral home? How does that work?
Well, usually you put the body in a bag that's designed for it, that's zipped up, and it goes into the morgue, and it's usually it's on a metal tray, and it slides into a cavity that's refrigerated, and then the funeral home is notified, and they come pick up the body, and they either cremate it or embalm it or whatever they do. So that's how that's typically happened. So.
And so if you have a busy day at the hospital, sorry.
Go ahead.
What were you going to say?
But as far as the capacity, I wouldn't think our hospital has even reached that capacity to need anything like that at this present time.
Do you know what the capacity is at the hospital there?
I don't know. I don't know.
So you think part of the...
I think part of this is a psychological endeavor of creating fear. So this is happening, but they want it to make it look bigger than what it really is.
Right. So what would you say your overall message is here now, 2 weeks in, versus, because when you were texting me before, it was kind of like, hey, huge uptake in patients. And I have to be honest, my impression was, now, wait a minute, how do I know that this guy didn't call me last week to say it's nothing, and then only to turn around this week and try and convince me, oh, it's a big deal?
Well, I have nothing to gain by saying it. For me, there's nothing personally for me to gain by saying that there's more than what there should be. I guess my take on it is this is going to affect a lot of people. It's going to kill a lot of people, but they are taking it to an extreme. And the other thing that I think the media is taking it to extreme, and whoever wants to create this fear about this, because this is all you hear right now. Right. And it seems like we've shut down our whole economy. There's going to be thousands of small businesses that are going to go out of business. The financial burden from this virus is huge. And the sad part of it is, I think a lot of this would not be as bad, but we have so many chronically ill people that this is affecting that we want to hide that. We want to hide the fact that most of these people that are getting sick, that are 65 and under, that are going to do very poorly with the virus, are people that is part of these choices that we make with our health that is
But I think
driving
you
us.
said people
So
under
that's something
65 who have normal health are not going to do poorly with the virus.
Correct. But there's so many people, percentage-wise, in our society that have poor health. We have morbidly obese people in their 30s and 40s that if they were to get this virus, there's a good possibility it could kill them. But if you would just look at a number saying a 30 or 40-year-old died from this virus, you're going to say, oh, gosh, I know a lot of people 30 and 40, and, and it's a lot different. People don't realize that somebody that's that young has so many health problems because of their condition that they're in.
Yeah, and certainly somebody who's morbidly obese, they has that term because they're so obese that it risks their life. But just to address the statement that you made earlier, I'm not presuming that you have anything to benefit from directly necessarily, or that any person who would attempt to social engineer this issue has anything to gain personally, but we know there are a lot of people who have gained quite a lot. Nancy Pelosi made over $5 million trading in Amazon.com stock, and so there are certainly a number of people who are financially motivated to cause the American public to believe that this is a virus that occurred by coming out of Wuhan, China, and now we're in danger of being made extremely sick if we so much as leave our homes. A veteran gave us a comment here on YouTube saying that he doesn't believe that the ventilators or the Navy hospital ship are for regular patients. A lot of people presume that there's some military thing happening. So here's USA 300 veterans. So the ventilators and the ships are not really for the coronavirus. Underground military operation in LA and NYC. I don't have any way of vetting that comment and knowing if that's true or not. I will say that we did see a counterterrorism unit of the NYPD standing next to a subway station entrance for the 7 train. It's the newest subway stop that I'm aware of. In fact, I wasn't even aware that it was active yet over there by the Javits Center. From a logical standpoint, it doesn't make sense how quickly attention was put onto that Javits Center project when we have heard extensively that the Elmhurst Hospital Center is in need of triage. We've got a triage hospital being built in Central Park across from Mount Sinai, which you've mentioned several times. Mount Sinai is not the hospital that needs the relief. It's the Elmhurst Hospital in Queens. So I don't know. We can't answer these questions necessarily. People who haven't seen my interaction with the counterterrorism unit of the NYPD should go back and look at that. I'm just going to let people know, if you recommend channels like X22 Report and other social engineering operations, you're going to get blocked here. X22 Report, if you're not a social engineering operation, you should contact me on truth@crowdsourcethetruth.org and offer us something that allows us to know that. And I do appreciate you taking the time out of your day in the ICU, but I have to say, without some stronger evidence, I think people are going to have to take your statements with whatever consideration they choose to take it with. Is there anything else you want to discuss with us?
No, that's about it. Like I say, I guess time will progress and see how this progresses in the area that I practice in. And I guess if there's not a way to verify the quantity of people that are getting severely sick, it's a frustration for me to try to share that. So that's my concern, is like, how do I share this without compromising, myself over this?
Right.
Because
Of
I'm not
course. Well,
trying to convince people that.
no, I hear you. But obviously, we want to share truthful information with everyone. Is there a way that you could have a media representative from your hospital contact me?
I could try. I could see if that's a possibility. So
Yeah, and certainly
because
that would set people's
there seems
minds
to
at
be a
ease.
lot of there's a lot of misinformation, and I don't know if it's why that would be. It would not be a HIPAA violation to discuss the amount of critically ill. I mean, that's just more information that they can share. It's not revealing people's names. Hospitals, they advertise or let known how many patients that they can take care of. I mean, that's common.
Well, I mean, see, the
Factor that
interesting
they
thing
can
is that
let
you're
people
hitting
know.
on a point that is a major point of concern. We can't reveal this information. We can't discuss this information. And so therefore, the hospital sort of has a blank check to tell us anything they want, and we have no way of verifying it.
Mm-hmm. Well,
So there's not a lot of ambulance activity around your hospital bringing in these patients. So during the uptick, how did the patients arrive there? Their families drove them there, or they walked?
families or some of them were transferred from other facilities, but a lot of times families will, or an ambulance would go to their house if they were not doing well, or they would go to their doctor's office, and if they were doing poorly at the doctor's office, then the ambulance would go to the doctor's office and pick them up.
Right.
It just depends on how sick they are at that point. If they need additional oxygen or not. Those
Well,
factors.
and the thing that people who've been watching Crowdsource the Truth for the past 2 weeks, who've been seeing me go all around New York City, I mean, this is the city that is being discussed all over the world as the epicenter of the coronavirus outbreak in the United States. And the fact that we haven't heard really, I think today we saw we saw 2 ambulances today, one of which was an ambulance that was called at my request. A pedestrian and I walked by an individual who was collapsed in the street, and we looked at each other, and this woman asked me if she should call 911, and I suggested that she do that. And about 10 minutes later, an ambulance showed up. That's only the second ambulance I think I've seen in 2 weeks. It doesn't really logically jive for people, including me, that we'd be having this historic event, and there's so little activity around the hospitals and with the ambulances and everything like that. De Blasio, he was asking for more ambulances. He even said in some statement today that he had a press conference, and he was saying that the ambulances are having 50% more calls than usual for this time. And frankly, to me, 50% sounds like the kind of uptick you'd get if you spent 2 weeks broadcasting hysteria on the news. I would think 2x, 3x, 5x the number of calls would be what you were dealing with if it was a huge pandemic. So again, I don't want to keep pressing you. I understand that there's not really tangible evidence that you can give us that would allow skeptics to overcome their skepticism. So I guess that might be all for tonight, unless there's anything else you'd like to share.
Nope, I'm good, Jason.
I appreciate you speaking with me, and I hope you aren't irritated by this line of questioning. If there is something down the road that we can bring to the audience that would help them have confidence, my goal is to just, so somebody says unneeded skepticism. Okay, I don't understand that comment, but I think we need skepticism for everything. People should be skeptical of everything that they hear in the mainstream news, be skeptical of things that you hear on Crowdsource the Truth. Be aware that having a guest on Crowdsource the Truth doesn't mean that I know every fact in detail about what the guest is saying, or that I necessarily agree or disagree with that guest, but I do want to thank the ICU nurse for coming back. I hope that you'll stay in touch, and if there's someone from the hospital that you could put in touch with me in some kind of official capacity who could help us have a better understanding of what's going on there, that would be appreciated, and I think some of the skeptics in tonight's call might have their skepticism allayed, perhaps.
All right.
All right. Thanks very much.
Thank you.
Thanks for calling, and thanks for watching, everybody. I'll see everybody tomorrow.